everybody, this is Jeannie Alice Bruce, and we are live today with our North Mississippi Health Services Chief Medical Officer, Dr. Jeremy Blanchard. And Dr. Blanchard has joined us today to talk about a very important and timely topic. We are going to talk about appropriately wearing masks and taking other precautions to prevent the spread of COVID-19 or the coronavirus. Dr. Blanchard, if you would just start by telling us who you are and a little bit about yourself.
Sure. Well, first of all, thank you for having me in this Facebook Live session. And my background is I'm a critical care doctor. I was military trained. Nobody in my family ever graduated from college. It's interesting, when I came to Mississippi, people told me, because I'm from the Northwest, I'm from Montana, people told me, well, this is really country, this is rural, and you may not understand this. And these are the commonalities between Montana and Mississippi, and most of them I love. One commonality is that a handshake actually means something. Now, during this time, we're not really having that opportunity to shake hands, but I think that concept still lives on, and it's very prevalent for me in my Mississippi experience and in my Montana upbringing. The second thing is relationships are prioritized. So, how I treat you, Jeannie Alice, or Deborah's also in the room, or how I treat others must come from a place of respect and a place of kindness. And I think that's prevalent in the Mississippi culture and in the Montana culture. And I think the other thing that's really prevalent is I expect to be treated with respect, as do you. And as long as we do that, then we do such a great job because of the baseline humility and kindness that exists in both cultures. But there's the funny parts that exist in both cultures too. Like people say, well, we have real rural areas. Well, I was raised in a trailer. I truly am. White trailer trash is what you see is what you get. I've worked since 7th grade, raised by a single mom. I only applied to one medical school because that's all I could afford. My mom handmade my suit for me to go. So I think I come from a place of blue-collar humility, and I think that's an important part, and that's part of the reason why I'm so honored to be in Mississippi and be part of this incredible health system. Last parts are I have the most beautiful, wonderful wife in the whole world, which Mississippi has done a great job of accepting. And I have the cutest Rhodesian Ridgeback ever. My kids live back in Washington. And then in this role, I have 7 hospitals, 43 clinics, and 4 nursing homes, and then all of the clinical leadership responsibilities. But those could be nothing without the incredible people that are delivering care. And if there's one thing COVID has shown, a couple things. One is we have the most incredible nurses and doctors and respiratory therapists and environmental services and nutritionists, but we also have the most incredible community. And that's why I have great hopes for this conversation today, because I need your help. We need your help. This is the only disease in my whole career where the prevention of it, the caring of it, in a pandemic state, which I've never really seen other than H1N1, but it's the first time where all of the superpowers live in the hands of the audience that's watching right now. If everybody masked, our economy would be able to be thriving and open. If everybody masked, we would know that we're safe. So, I saw something on Facebook that really, and I think it's apropos for what we're talking about, that really touched me, and it had humbleness, kindness, which I actually think should be respect and community. And the humbleness was, I don't know if I'm infected. So let me give you an example of that. Out of the journal Thorax, just recently, within the last month, they looked at a cruise ship that had 217 passengers and crew members, and they had COVID. And so they went ahead and they tested every single person, and 128 tested positive, but 104 of them were asymptomatic. So 81% of the population who tested positive for COVID were asymptomatic. So I am very humbled by that, because I could have COVID. That's why all 3 of us in this room are wearing a mask. And so that's the first thing. The second thing is respect. So my mom died of cancer. I have a daughter with learning disabilities. I have older friends that I care dearly about. And you don't know that about me. And I don't know whether you have somebody who has cancer, or an older person in your life, or if you have diabetes. And so I, out of respect and kindness, but out of respect, I wear a mask when I go out in public. And then the last part is community. I want our community to thrive. I, like many of you, continue to go do pickup. I go to Woody's, I go to Park Heights, I go to Mount Fuji, I go to Baskins and Robbins. I'm trying to support the economy, but my best way to support the economy is to wear a mask. So that's about me, and that's why I'm doing this talk today.
Great. So you covered a little bit about why wearing a mask is important. Just for you personally, what is the hardest part for you of wearing a mask?
You think it'd be easy for me because, I'm pretty passionate, but, and the other day I was in one of a local pet stores, PetSense, and my dog is my baby, and he needed a new leash because he had chewed through his other. So I went in there and I wore a mask, and there were probably 20 other people. There was one other person wearing a mask, and people looked at me like I was silly. Or, and then I made up my own stories. I don't know if they're true stories or not, but I made up my stories that they thought I was one political, not denomination, but one political party member, and they were another political party member, and I realized I was making up stories, and I just smiled because my eyes squint when I smile, so I know that I could just smile. So I just smiled at them and kept my distance, but I felt awkward, and I thought, wow, it takes a lot of courage to be wearing a mask, but man, you deserve for me to wear a mask. That's the first thing. The second thing is I have glasses, so my glasses fog up, and I look silly with that. And then the third part is I know, because of my role and my background, how important nonverbal communication is, and I lose so much of it when you're wearing a mask, but it's the world we are in for a long time now.
Right. Okay. So you're wearing your mask correctly. Can we just talk a little bit? Will you just show us what the correct way is to wear a mask, and kind of go over those important points that you want to make sure to cover, and then maybe some of the ways you see people wear masks that are incorrect?
Sure. So first of all, important part of wearing a mask is why are you wearing it? So I'm really wearing it to decrease little small drops of saliva and particles for being exposed to you and other people in the room. So to do that, I have to cover my nose and my mouth. And so that's the key part of wearing a mask. It also protects you somewhat too, but the key protection is if we all wore masks, then if you're asymptomatic, your ability to share those germs, for lack of a better term, is much limited. Now, I actually, I sort of like to laugh, and so for me, sometimes I think people are funny. So this is one of my favorites. I call this the Pinocchio.
Right.
This is totally useless, but you see that quite often. I call this the drool catcher. So this is for the high saliva output individuals, such as myself, the HSOPs. And then you got the sling. I like this as the cowboy. Because the people that wear this, most of my experience, they think they look pretty cool. So they got the, hey, how does this look? and then I think you got, and it's better with the other kind of mask, but you got the unicorn, which you got your little horn there and your magical woods.
Right.
And then every now and then, which I haven't seen yet, but I keep waiting for, but I do see it with one of the other types of masks, is they'll actually put it on backwards, hang it off the back of their head, and I call that the Sasquatch. Because when you see that one on the back of their head and they turn around, you just see this hairy head and this mask where their face should be. So those are some examples of where, really that does absolutely no value, and I think it's disrespectful.
Right. So the most important thing is that your mouth and your nose are covered, and that's protecting those around you from anything you might be breathing out or speaking out or whatever.
So that's not just me saying that. So there's been quite a few studies done, but one that really stuck out to me was one that was done in Hong Kong during SARS. So SARS was huge, very contagious, very lethal. Hong Kong had big issues potentially with it. And so what they did is they looked at their clusters of SARS infections when people were wearing a mask and when they weren't. There were 11 when people were in mask-off social settings.
Okay.
So Memorial Day is a great example of that. I know that because we have a surge right now because of Memorial Day.
Right.
That's where everybody goes to a family picnic, or people go to a funeral and they choose not to wear a mask, or they don't, and they also don't honor social distancing. So what they found is if you wear a mask, if you wash your hands, and if you clean frequently your home environment in case people are visiting, that you actually can very much decrease it. So they, in the group that had the 11 versus they only had 3 where people were wearing masks appropriately.
Wow.
And it was very significant. We also found that when you looked at a group in a flu epidemic that could or could not wear a mask, that wore cloth masks and then wore isolation masks, that the cloth masks were better than not wearing a mask. And that an isolation mask, and that's why in North Mississippi Health Services we require our employees and staff to wear at least an isolation mask, not just a cloth mask, except for these special ones that I'm wearing, which actually has silver and copper impregnated in it. But those masks decrease by 13 times your risk of infection. And so, and again, you get another fold just by wearing any mask.
Right.
So even in the public, a bandana is better than not.
Right. Okay. So I want to talk about some common myths and questions that I see on Facebook. One thing I see pop up repeatedly is that it is dangerous to wear a mask all day, that it causes us to breathe in too much CO2, or we're breathing back in our own germs. Is there any truth to that? Is there any danger to wearing a mask even if you wear it all day?
No, there's zero. I mean, that's, how do you think surgeons and surgical
Right.
techs and, you know, the whole work, and even in the car industry and things like that. So that is totally a myth. Actually, we're planning on trying to do a video showing us do workouts with that to prove that for people who
Yes.
don't believe me. But for one, this has no blocking of carbon dioxide. Carbon dioxide exists in my lungs, in my nose, in the air around us, and there's no difference in equilibration. I mean, if you totally contained a room that had no air movement, then you could affect that.
Right.
You can create masks. We aren't using any of those type, but you can create masks that could create that effect.
Right.
But you really have to have such a tight seal, and this doesn't have a tight seal.
Right.
And then the second part is relative to oxygen. Again, it has absolutely zero effect on that.
Right.
So that is a myth, and I think it's tragic that people are doing that.
Right.
There is a myth that I wish was true.
Yeah.
So that myth is you'll see on Facebook that you'll show a person wearing a mask that is an asymptomatic infected person. And it'll show that the other person has a decreased % chance of getting the infection if they weren't wearing the mask. Then they'll show if the person who isn't infected is wearing the mask and the other person is, and they give a different number that's smaller. And then they show if they're both wearing a mask and then a very small number of either one contaminating each other. That there is no evidence to support that's true. No one has looked at that. There's no literature. I've actually looked aggressively for that and have found no literature supporting that.
Okay. So an important take home is don't believe everything your friends share on Facebook and stick more to what you hear from the experts.
Well, and I think use the right sources. So
Right.
I think that's even more important. So, for example, you know, whether you like the CDC or not, the CDC is sharing information to the best of their abilities.
Right.
I think the World Healthcare Organization is another. Dartmouth is another one. Johns Hopkins is another one. Mayo Clinic is another one. So I think if you go to those sources to look for that commonality, I think that's really helpful.
Right.
I think there's great intent out there that is misdirected.
Sure. We've had a lot of people join us since we started, so I just want to take a moment and reintroduce. This is Dr. Jeremy Blanchard, North Mississippi Health Services Chief Medical Officer, and we are talking about the COVID pandemic, particularly how to prevent the spread of it by wearing a mask and taking other precautions. And I also want to remind our audience that if you have any questions for Dr. Blanchard, please feel free to put them in the comments, and I will try to ask him while we have him here for this conversation. My next question is that another common rumor I see on Facebook is that a lot of people believe that wearing a mask is not going to do any good, that there's no reason to wear a mask. And can you address that? Can you explain how masks are, again, briefly, how masks will help us prevent the spread of COVID?
Yeah, so first of all, you know, as I shared earlier with that cruise ship, 81% of the people who were infected, 104 of the 217 on the cruise ship were asymptomatic. So the first challenge is, just because I look nice does not mean I do or do not have COVID.
Right.
Just whether I'm wearing a tie or I'm wearing a t-shirt and flip-flops does not tell whether I'm male, female, old, or young have it. And so there's this thought process that my friends don't have it or I can't have it. And that's not true. The other is that this only kills older people, and that's not true either.
Right.
We're finding now as the younger generation sometimes is feeling less vulnerable, we're seeing a rise in those number of patients and illness in those number of patients. And so what the mask does is the mask actually blocks in an asymptomatic person the major release of particles. So there's been a couple places where it's been obvious when people have it that we have literature that is very scary. There was a choir in Washington.
Right.
There is nursing homes that have been infected by visitors coming in. And then there is a church in Oregon that did not do masking, did not do social distancing, and the majority of their congregation is now ill, and many of them have passed away.
Wow.
So it is real. It is here with us. It will take time for us to find treatments that work and things like that. The other part that I think is unrecognized is we do not know two things that we think we know. So we think people think that you'll be immune once you get it. Nobody knows that.
Right.
Hepatitis C, you get antibodies and you are not immune from its effects. The second is that later on you won't have chronic injury from the disease.
Right.
And we know Dr. Max Taylor, our infectious disease doc, has actually shared that we are very concerned, and his community is very concerned, that there will be a chronic illness that's very similar to what the complications associated with HIV, because the cell that's affected by this virus is the same cell. It's sort of the head of the orchestra, the maestro of the orchestra of your immune system. And if that maestro is injured, you can imagine if your orchestra are playing in all different times and cadences, it would just be cacophony and noise. And so that's a real concern too. So we have to wear the mask. And then I think that last part is what I alluded to early on, is that you don't know whether the person next to you has a child that has immunocompromised state,
Right.
or a wife or a husband that has cancer, that going through chemotherapy, or an older person that they love that could die from this.
We got a question from an audience member, Connie. This is a great question. I appreciate you submitting it. She wants to know if you should wear your mask outside, like when you're at the beach or lake. And I would like to know if you should wear it if you're in a group, like a group of runners or cyclists.
Right.
Should you wear a mask?
Well, I think, this is going to be very crude, but I think it works really well. And the key is with social distancing, we say 6 feet, but a great way to think of it is if one of the people in your group passed gas, could you smell it?
Right.
And if you couldn't smell it, if you're far enough away that you couldn't smell it, so 6, 8 feet, then your chance of getting it is much less.
Okay.
So I personally use the approach that if I can gain that social distancing, then I don't necessarily need to wear a mask. So when I run, I don't wear a mask. When I do my bike, because I work out every day, I don't wear a mask. When I'm in my car, I don't wear a mask. As soon as I head into Kroger's, Lowe's, a restaurant, any of those things, I put on a mask appropriately.
Okay. We have another question from Amanda, and this is a little bit off topic of masks, but it's a great question. She said, what about antibody testing? Is that something that we're doing, antibody testing?
Yeah, so antibody testing is an interesting topic, because when antibody testing first hit the market per se, there were about 21 tests that were very similar to pregnancy tests. And they initially, the FDA approved them, and then they now have pulled their approval of those tests.
Okay.
That's where the misinformation about antibody testing came from. So we actually use an orthodiagnostic, FDA-approved antibody test. And it has 2 antibodies in it. It has an early antibody that catches you as the infection is growing, and then one that shows that you've had the infection. And that has, if it's positive, we're positive you have the disease. It doesn't have very many false positives associated with it. And if you have the disease, we're positive it will pick it up. What we can't tell when we get it back is, do you have acute disease or did you have the disease in the past? So we actually then do a PCR, which is the other kind of test that has the big, deep nasal swab on it.
Right.
We do that test to confirm it.
Okay.
So, for example, we have tested in our peri-surgical and peri-procedural staff and as physicians and providers, 1,136 of them. And of those, we've had 12 antibodies positive.
Okay.
And of those antibodies, we've had 3 PCRs positive.
Okay.
So that means 1% of that population have been exposed to the virus and caught it and dealt with it. 9 of them have dealt with it. 3 of them have acute disease.
Have another question from an
Sure.
audience member. Dustin, thank you. This is a great question. I would like to know too. He says he has an 8-year-old and a 9-month-old. Is there any harm or recommendation as far as wearing a mask for kids? Should kids wear a mask?
Yeah, this one's hard because they don't like wearing the mask, so
Right.
you got to make it sort of fun to do,
Right.
you know, sort of the Lone Ranger, except over your mouth and nose, but
Right.
yes, they should.
Yes, okay.
And the biggest risk for kids is we initially thought was just to be carriers, but there's
Right.
actually a pediatric version of COVID now
Right.
that's incredibly severe
Okay.
and worrisome. And so we are actually starting to see that hit the population across the U.S. So if I had a 9-month-old and a 8-year-old, the 9-month-old, I'd figure out some kind of like buff or something that might be easier for them to
Okay.
keep on. I'd just put it back up every now and then. And with the 8-year-old, I'd try to do a smaller version of a mask that you either can make. CDC has guidelines on how to make a cloth mask,
Okay.
or, you know, it's time for the cowboys and Indians and put the
Right.
bandana on them.
Okay. This is another question from Martin, and this is a great question also. Should masks be washed daily, or should we use disposable masks?
Well, so there's sort of two different topics. So the disposable mask, you know, ideally you would use a different one every time you do an interaction.
Right.
However, we don't have enough disposable masks, anybody to do that. So what
Right.
we use with disposable masks is we use them unless there's soiling.
Okay.
So if they get something on the front of them that you can see, then we throw them away.
Okay.
With a cloth mask, really you're not at risk for your own germs
Okay.
or anything like that. So the real issue with a cloth mask is, you know, is cleanliness. So like my cloth mask, because it's silver impregnated and has copper in it, that has been shown by the FDA to kill viruses when it
Right.
comes across and to kill microbes, we can wash these masks up to 15 times.
Okay.
We can't wash them in hot water. It has to be warm water. And then we can't use chlorine-based substances because it'll take the silver out of it. So I wash them every 3 or 4 days,
Okay.
or if it's soiled.
What about just the homemade, just plain fabric mask? Just wash when they're soiled, or every
Yeah,
few
I'd
days?
say wash when they're soiled, you know, I mean, or, you know, if they get funky.
Right.
I mean,
Okay.
I think the funky kind of barometer is a pretty good one.
Okay, good deal. So I have some more questions that are COVID related, but not exactly mask related.
Sure.
So
Any questions okay, audience,
Okay.
by the way?
So another super common question and rumor that I see on social media is that we, whether it be our system or we as a healthcare system nationwide, are inflating the numbers of COVID cases to increase reimbursement. Is there any truth to that? Can you address that rumor?
Well, there's no truth to that.
Okay.
So, for example, I have never, ever, as a system CMO, had a conversation with a doctor that you need to code differently.
Okay.
So the coding of patients lives within the hands of the doctors. Now, what I will tell you, what I have emphasized from the very beginning, is a test does not determine if a patient has COVID or not.
Right.
Because you have some tests that are false negative.
Right.
What I recommend we do, and what we do is we go based on the acumen of the physician
Okay.
or the nurse practitioner. So basically, their clinical skills to say, does this patient look sick?
Right.
That's how we make a decision whether they're admitted to the hospital. And then whether they go to the COVID unit, we don't test them acutely to decide where do they go because of the number of tests available. We have a lot, but we don't have enough to be able to do that.
Right.
So what we do is we admit them to a contained unit that's protected. People are wearing the appropriate equipment if we're suspicious for COVID, and then we test them at that time.
Okay.
So whenever I quote numbers, or I do presentations, I go to our coding material based on the doctor's suspicion to say what our COVID levels are.
Right.
And then I think the second part is relative to financial support. This is the irony of the whole thing, is we do get support to help us handle the burden of COVID patients,
Right.
but our financial burden is not from the COVID patients.
Right.
It's actually, initially was because nobody would come to the hospital and we stopped elective surgeries.
Right.
So we had a huge financial burden because we had predicted we'd have a certain patient volume and we didn't, and we had to address that. And our team responded brilliantly to that, all the way down to, the environmental services. Everyone on the team was wonderful in that regard. And then the second thing is now, since people waited to come in, they're coming back, rather than coming back routine, they're coming back urgent. So now the medical population has actually filled up our beds. People think it's elective surgeries. That's not the case at all. Our elective surgeries are a very, very small part of it. The part of it that really is taxing us is our medical admissions. And we want to take care of those patients. And we've been dealing with, since the beginning of time, shifting resources.
Okay.
The other fallacy that that hits on this that you probably would get into, so I'm going to go there now,
Sure.
is that it's not about how many beds do we have.
Okay.
It's not even about how many ventilators do we have. We have plenty of beds, we have plenty of ventilators, and we have plenty of personal protective equipment.
Okay.
Our challenge are nurses.
Okay.
Is our nurses are working as hard as they can. So we shift our nurses based on our COVID and our non-COVID, but we don't think of it that way. We
Right.
think of it, who needs clinical care?
Right.
And the only place COVID comes into place is they need a certain kind of room so the germs aren't spread,
Right.
and we need to wear certain kind of equipment.
Okay.
But in the end, all of it, our coding, our care, our placement is based on how sick you are.
Right.
And so that's a consistency. So no, we are not padding bills. We're not doing that. And there's absolutely no way I could do that even if I wanted to.
Right.
So, which I don't. But
Right.
I mean, it's no, we're not doing that.
Okay. And then this sort of relates, and you started to touch on it, but another question we get a lot is why don't we share the number of critical care beds that we have? Why don't we give that information out?
Yeah, so I'm asked that a lot, and the challenge is that is very dynamic.
Okay.
So, for example, early on in the surge, when we had a decrease in volume of non-COVID patients, and we had the nursing resources, we actually could have gone up to 158 critical care beds if we had to. We had the ventilators, we had the appropriate personal protective equipment, we had the appropriate staffing. We would have had to use very unique models to do that. We would have had an ICU in our recovery room in the OR to do that. And then as we have not needed that, we have sort of gone back. We had 88 core beds that had negative pressure that we could do ICU care with. So we always have that ability to expand that. The question will be, do we have the nursing care to do that?
I gotcha.
And what has made us really strong as a system is we actually have dealt with this as a system. So even as of today, we are transferring some patients to our community hospitals to receive appropriate care there because we're giving the same level of care across the system.
Right.
We created a system approach to care that allows us to increase our opportunity to do critical care beds. So, but I can't tell you that number because it's in such fluctuation. If I told you a number now, in 5 minutes it would be wrong.
Okay. And this is another question from Martin that is similar to what we just talked about, but he wants us to go into it a little bit more. He says, what about claiming a death is a COVID death, irrespective of the cause if the person tested positive? So I think that means like, if I die from a heart attack, but I also had COVID and you claim it as COVID. He said, does that happen? And doesn't that skew the stats just to scare us?
Well, one, I appreciate that question because it's hard to write those kind of questions in this format. So thank you, Martin, for that. I don't know of any case where that's the circumstance.
Okay.
I do know cases that might apply that I want to explain.
Sure.
So if you have somebody that dies from severe kidney failure, they die, a diagnosis could be kidney failure. But if they had COVID, COVID is directly responsible with small little clots forming in the kidneys causing that kidney failure.
Okay.
So we would claim that as a COVID-associated death.
Okay.
COVID in itself is associated with many different illnesses. It has a very bad pneumonia with it. It has a really bad encephalitis. Some people are having liver issues. There are heart issues directly associated with it. So Martin's right in the sense of, do people who have other diseases have an increased risk of COVID and an increased risk of a severe infection? That is absolutely correct. If you have diabetes or you have hypertension and you're older and you're a male, you're specifically at risk for a severe disease.
Okay.
But we are not testing all people to see if they have COVID to claim them as a COVID.
Gotcha.
So when somebody comes in and has a heart attack, we don't go, oh, let's check them for COVID.
And then claim that they're a
And
COVID
then claim
number.
they're COVID,
Okay.
right.
Gotcha.
Our people that are admitted with COVID that are dying from COVID are severely
They're very
sick.
sick.
I mean, they are bilateral lungs. We can't manage their lungs. They're dying from inability to breathe adequately. They're having associated dysfunction of the heart and the kidneys. They have bleeding issues, and they have brain issues. And so I appreciate that question, but I can tell you in North Mississippi Health Services, we are not coding people to try to get reimbursement. Right. We're coding people that have directly related COVID death.
Okay.
A great example of this would be if it was a trauma and
Right.
it came in.
Okay. Another question from Amanda is it safe to have elective surgeries right now?
It certainly is. So one of the things, Amanda, that we did to assure that it was safe is we wanted to know how safe was it in our hospital. So within our health system, we have 7,125 employees. We have had less than 0.5% test positive from workplace exposure. And from community exposure, though, we're somewhere in the 2% type of range. So it's much more dangerous to go to Kroger's than it is to get a surgery done. And then we wanted to make extra sure. So what we did is we did antibody testing, which is our strongest test. There's no way you can't do it appropriately because you take blood. And we did that on, as I said, over 1,100 of our employees, associated physicians, and staff. And we have less than 1% that have any active infection, and we've picked it up. And which is the same as our patient level that we've checked coming into those elective surgeries. And we've had 1% that have been exposed to it over a period of time. So because we're choosing to wear our masks, because our employees are actively engaged in that, and we're having them do that work, this is the safest place because everybody's wearing a mask.
Right. And Amanda, I want to tell you also, a few weeks ago, we had another Facebook Live with Dr. Heyer and Dr. Montberry, where we went really in detail with what's happening at North Mississippi Medical Center to make elective surgery safe. If you want to go back and watch that, it's got a lot of really helpful information. Dr. Blanchard, the other question I want to talk to you about, and this might be a dangerous question because of the environment and the climate that we're in, but somehow wearing masks has become a political conversation, and people take it as being related to your politics. Can you address that? Can you talk about that a little bit?
That makes me so sad.
Right.
So one of my executives has died from COVID.
Right.
And he left a wife, 2 kids. He's in his 50s, a wonderful human being. There is no place for politics in this. No place. This is about humanness. This is about being humble enough to not know whether the other person's story is. Do they have someone at risk? Do they have a child, a wife, a husband, a grandmother, a grandpa? It's being humble enough to wear your mask. It's being respectful enough. When I came to Mississippi, when I said how nice people were, they said, well, that's Southern hospitality. And I said, well, it's a lot like Montana. And they said, well, then you guys must come from a place of respect. Because we teach our kids to say thank you and you're welcome. And I will tell you that to me, if you want to show me Southern hospitality, the most respectful thing you can do to me is wear a mask.
Right.
That is true respect. And I just do not understand how it becomes a Republican and Democrat issue.
Right.
This is really about humanness. And I think in the end, the third thing is if you want the community to be able to thrive, you got to wear a mask, because as these numbers go up, there will be no choice people have but to begin to lock us back down.
Right.
Because they won't know what else to do. It's the only thing that looks like it's worked. So there is one thing that went out on Twitter today from a reputable source, and if you look at the states where the number of cases are going up, they're the ones that have lifted masking, and the ones where it's going down, they're the ones that have added masking.
Right.
And I just plead to the audience, please be leaders. Be the leaders of respect, of Southern hospitality, of kindness, of humbleness. Please wear your mask. Please.
Thank you for that. I have another question from Rochelle. Have you seen many severe cases of COVID requiring hospitalization in patients who have no underlying health issues?
So we have had about 70% of the people who have died from COVID in our hospital have 2 underlying comorbidities.
Okay.
And then a small percentage have none, and then a medium percentage have 1.
Okay.
But there are people with no comorbidities that do get severely sick from this.
Okay.
And I think in the end, we're going to find out that certain people have a DNA structure that makes them sort of overreact to this versus ones who don't. We saw that in sepsis, which is an overwhelming bacterial infection in the past, and I think that'll turn out having that commonality in this.
Okay. Another question from Tony. Are your visitors required to wear a mask in patient rooms when they come to visit?
We ask them to, yes.
Okay.
Because what we're trying to do is we're trying to decrease exposure for our staff as well.
Right.
It's very difficult to have an enforcement environment, so we are trying to have a coaching environment.
Okay.
So all visitors have to wear a mask. We ask them to wear it appropriately. We coach them if they don't, and we coach them if they're not wearing it in the room.
Okay, great, thank you. What other tips do you have for us? You know, as everybody knows, we're seeing another uptick in cases. So what advice would you give us as the economy begins to reopen, but we still want to keep ourselves safe?
Yeah, I mean, I think it comes down to superpowers, which live within the audience, and me too as an audience member, but really, healthcare doesn't have control of this virus. The control lives in the community, and wear a mask appropriately, wash your hands frequently for at least 20 seconds, and then the other is social distance. If we did those three things consistently, Mississippi wouldn't have a virus issue.
Right. Okay. Thank you. Is there anything else you want to add before we wrap up? That's my last question.
Yeah. I'd say that the first thing I want to say is thank you to our nurses and our caregivers, our physicians, our nurse practitioners, our environmental services, respiratory therapy, dietitians, pharmacists, radiology techs, every person who's involved in the care of a patient. Thank you so much for what you do, because every day you're putting your life at risk, and I have so much respect for that. The second thing is I want to say I'm so sorry for anyone who's lost somebody from COVID. And I recognize as we make visitation policies that we are directly hurting people because they can't be with their loved ones and they can't have people with them. And I do not take that lightly, and that's what I lose sleep over. As a son whose mother died in a nursing home, you know, I could be there to say goodbye, and some people can't, and for that I am so sorry, and my heart breaks. The last part I would say is thank you to the community. I mean, one night I walked out, and I'd never heard of the song Surrounded, and it's so powerful, and I was so blessed to hear 3 young ladies singing that. But that's just one example of all the wonderful things: donations of food, donations of masks, coming to celebrate with us. And the biggest celebration, the biggest gift you can give us, though, is to wear your mask, wash your hands, and social distance. But thank you, Tupelo, for being so wonderful.
Great, thank you. Everybody, thank you so much for joining us. Thank you for all the great questions and comments. Dr. Blanchard, thank you for your time. I know you're very busy these days. Everybody, this video will remain on our Facebook page when we finish. Please share it. Please share it on your Facebook wall. Share it with your friends and family, and just encourage people to wear their mask, wash their hands, and take all the precautions they can to stop the spread of this virus. Thank you so much, everybody, and have a great rest of your day.